Welcome back to Upper Michigan Today, everybody. We've pulled in Jody Lockman-Samkowiak into the conversation. She's the vice president here of the Specialty Infusion Center in Marquette Township. We wanted to thank you for having us this morning, and we'll start out with a general overview. What is the Specialty Infusion Center?
So our Specialty Infusion Center here is, we specialize in biologic therapy, and for patients with autoimmune diseases like multiple sclerosis or,
Yes,
like Crohn's disease and stuff.
multiple.
Yes, yeah, and then Lori will talk a little bit more about that. But we're very proud to have opened in Marquette. We have a center in Gaylord and one in Traverse City, and so it's really helped that we focus on rural areas that have access to care problems.
Yeah, so filling a certain need for
Yes.
some patients here in the Upper Peninsula.
Yes. Yep.
And when did you open? And
We opened in December. I'm a doctor of nursing practice, so I've done infusion therapy since 1988. And so we opened in, the company itself started in 1989. So we've been around a long time. But here in Marquette, we opened in December.
it just took a few decades to come around to the Upper Peninsula.
And we are accredited by ACHC, so we meet very high standards for our therapies.
So how does it work? If I'm a patient that needs some a treatment or a therapy that you offer, do I reach out? Do I work with my doctor? Do I work with the hospital? Or what is that relationship?
Yeah, you can reach out to us, and then Lori, who you'll meet in a little bit, she will reach out to the doctor and see if the patient can come here.
Sure.
A lot of therapies are no longer allowed to be given in the hospital setting. They have to be in an independent infusion center, and that's what we are.
So are you covered through insurance or is
Yes.
yes. Okay. So
we
you work
don't do the spa type treatments. We're specifically medical.
Okay.
Yeah.
Okay.
What kind of a difference do you see this making in the patients, having a specific specialty infusion center as opposed to those patients having to visit the hospital for treatment?
I think patients are treated one-on-one, very specific time with the nurse. They receive a full assessment. Their therapy is given, the communication with the physician. Everything is supervised by Lori Schley, who you'll meet in a minute, and she is an oncology she's a chemotherapy biotherapy certified nurse. So every case is supervised by her, and I think our accreditation shows that our standards are extremely high.
In addition to Lori, who we'll meet in the next segment, what other staff do you have here?
So we have the person who's here the most is Lee Beth Scouten, and then Kathy Pelto. And Kathy covers more of the Western UP, where possibly it's too far for patients to come here. So she's able to see them in the home if they're on the very far western side.
And I know we're going to be doing a tour later on in the program, but overall, you know, I'm looking around, I'm seeing different kind of rooms and settings. So what is involved here?
So we have 2 private rooms, and then we have general areas that have some privacy by division. Patients can kind of choose which room they want to go into. And they are then seen by a nurse who does a full assessment, gets their, making sure they're okay to treat, and then gets their IV started, prepares the medication, and infuses it. And the patients are monitored throughout their infusion for any side effects. And some of the medicines, they have to stay afterwards just to make sure that there's not a delayed reaction.
How long does a treatment, I'm sure there's a wide range, but overall, you know, kind of average, how long does a patient spend here?
So we have some patients that are here for an hour, and then we have some patients that are here all day. Yeah, depending on their therapy.
So obviously comfort is really important, and
Yes.
privacy is also
Yes.
really important.
Yep, yep.
In terms of numbers of patients that you serve, do you have an estimate that you have coming into the building currently?
And I'm not sure, maybe Lee would have a better idea, but there are our patients sometimes aren't treated real often. Some of the therapies are every 6 months. Some of them are every 4 weeks. So the patients that are coming here are spread out.
Sure.
Yep.
So really personalized care, too.
Absolutely.
So we're going to learn a little bit more about some of the care that you offer, the treatments, and some of the conditions that someone might come here for a treatment for. We're going to take a break and meet Lori when we come back.